clinically, if you speak to clinicians, they're all crying out for it. They're all of the Royal Colleges, they all recognise that better care can be delivered in larger specialist hubs. Certainly the surgeons think that, certainly the paediatricians think that. And so you're absolutely spot on. If you were to do a national plan and you were to look at a map and you would look at the demographics and you would look at the transport infrastructure, you may very well come up with completely different locations. So 8, 9 wouldn't be the location. It might be because of the hospital over here, you might put it at 5 and then another one at 10 and or whatever. You could come up with a completely different, and I understand that, which is why I said at the start, I've had to snatch out a piece of the countryside and say, right, I'm going to do that, and this is the middle of it. And I recognised immediately that there was a potential error in doing that, but I have no choice because we just don't have the capacity to do a national plan, sir. There's 2 of us, we just can't do it. And so you're right 100%. I don't disagree with anything you've said, and that some of the roads in the area are just not fit for purpose. Personally, being the MP for Bracknell, it does always make me wonder why it is you can't turn left on the junction 8-9 when you come out of London and go to Bracknell. It seems crying out for that road down to Bracknell. I'm sure there are historic reasons I'm not aware of as to why that didn't happen, but you're right. And all I can say is that I have been to the Department of Health more than once. I've met with 2 Secretaries of State more than once. I'm not aware that anybody in the Department of Health is doing this work. I can't get a straight answer. I don't know why. It seems inevitable that we're going to have to do this. It seems to be happening piecemeal. Local communities are coming to the conclusion like they did in Northumberland. Personally, I think it would be much better for it to be done in a national sense, and then there would be more honesty about where the locations and more transparency about where the locations should be. But at the moment, there's no appetite for that, and I don't quite understand why, but that's how it is.
Could I just have one last bit? I was in a session a week ago about transportation in this area, where I discovered, whether it's right or wrong, but it was coming from an official source, that the plans for Crossrail rely upon statistics many years old, and the decision therefore pinpointing Maidenhead does not reflect an assumption that several thousand people will be coming into Maidenhead as a result of Crossrail. So it seems to me that Crossrail points to another major issue in terms of transportation in this area, but it also means that if people are visiting a hospital at 8-9, they'll come by train. So there's a plus and a minus there, and if you can't you can't have a public meeting like this where such major issues are being discussed, if the minister's representative is not here to take some account of what people feel, whether he be the Transport Minister or the Health Minister, both of which are key to this decision.
Well, what you have got is, if you live in Hollywood, your local Member of Parliament
Sorry.
to be able to take that up from you. So, I mean, you mentioned Crossrail. There are all sorts of issues we could get into if we were going to talk about Crossrail, but I suggest that we perhaps stick to the hospital issue, and there are several other people I know who want to take questions. There was a gentleman in the green jacket there, then this gentleman in the blue jacket here, and then over.
Thank you very much. I'm Terry Price and I live in Marlow, and with a couple of groups we've campaigned obviously for the retention of services at High Wycombe Hospital, which have been reduced, and I can tell you now is that services have been reduced and will continue to be reduced at Wexham Park and various others in the area. That is a fact. So, you know, it's not scaremongering or anything else. Is what I would ask you, Dr. Lee, is never mind about whether it should be 6, 8, 10 or wherever. We're actually talking about the proposal, which is 8, 9. And I would ask, is the land available should this project go ahead? And has this project been discussed with the Health Secretary? Because that's very important. But I would suggest, taking up a point which you made, is that this is going to be locally driven. In other words, you are the people who are going to make this happen. Make no mistake. Never mind about the politicians, because this should be above politics, is you need to get behind wherever this is going to be built, such as a group called, if you like, the Friends of the Royal Thames Valley Hospital, so that it can become a conglomerate from Wickham, from Marlow, from Maidenhead, from Bracknell, and all places east and west, is because until you get your act together to pursue this and press for this, it won't happen. That is a fact. And assuming that everything is all okay, is, you know, let's get cracking and let's do something about it to gain this support. And effectively, if you don't do this, then we're all wasting our time. So I can tell you that the public meeting in Marlow, yes, we would like it, if you like, at Handy Cross or in Wickham, is be brilliant, but it ain't gonna happen. You're kidding yourself if it is. So never mind about the loss of part of Wexham Park, is that will still be a hospital dealing with local entities, the same, but on a much, much lesser scale. Let's crack on. Let's get behind Dr. Lee, as the people of Marlow have done, because yes, like you from Maidenhead, we have a vested interest in getting a hospital like this at junction 8, 9 or wherever is. So I can only say, yes, you have the support of a lot of people in Marlow, in fact the majority of Marlow people, and I would suggest from my colleague here is that you would have a tremendous amount of support from the people in the Burnham area. So thank you ever so much. I'm sorry if I'm a little bit croaky. My missus tells me it's rather sexy, but you've got our back.
Thanks, Terry. I haven't spoken directly to the Secretary of State. I've spoken to the previous Secretary of State for Health, knows about it. In fact, his 2 daughters were born at Heatherwood, so he knows the area. And I've also spoken to 2 current health ministers about it. Everybody has had a copy of it. But as I've said to the gentleman before, there does not seem to be much enthusiasm to entering into the debate of reconfiguration of hospital services from the political side. And I don't know why, because there's an inevitability to it, as shown in South East London, South London and West London as we speak. But thank you for your comments.
Tony Ruffle, live in Maidenhead and much involved with recently taking people to hospitals for clinics. Mm-hmm. And for that reason, I'd very much like to hear your views on what facilities are perceived for a new hospital. Mm-hmm. Is it just for operations and the use of major facilities which cost huge amounts of money and can't be duplicated everywhere? Or is it intended that such a hospital should be supplemented by smaller units like St Mark's, where consultants can be seen locally?
Okay, if it's at junction 8-9, so on the proviso that it's at junction 8-9, when I was talking about this, I had to look at how much approximately it would cost, and there was some quite broad range of prices for hospitals in different parts of the country, so it's quite difficult. And I ended up with 500 million as being a ballpark figure for the whole thing. I then had to think, well, how on earth can you sort of at least try to set it up finding part of that money? So in trying to do that, I came to the conclusion that where you would try to retain the sites is in urban areas. So you would retain Upton Hospital, perhaps reduce the size of it in Slough. You would have the Bratsbridge site in Bracknell. You would retain Townlands Hospital in Henley. You would retain the Wickham Hospital in High Wycombe. Perhaps on a reduced site, the nursing accommodation could easily be sold, I'm told, to Bucks University as an idea. But no, St Mark's would be sold outright because the hospital at 8-9 would provide services. Now, it would have outpatients, it would do all of those things, but for the communities of Bracknell and Windsor so Kingham and the 7th would also be retained. They can all have their outpatient appointments in their towns. They can have their routine procedures in their towns. There's no reason why that can't be allocated for. But if you are acutely unwell and need a major operation, or you've had a trauma or whatever, then you go to Junction 8-9. The people of Maidenhead, if they're having an outpatient appointment, would go to Junction 8-9, and they would do all the things. So you would be driving people up to Junction 8-9. So it's going to be a hospital in that sense. But the fact that it is big enough and serving a big enough population means it can offer all of those additional services. And the ones that we retain, the spokes out of the community, provide the chronic care, which is actually what the majority of reasons that people are going to park in the car parks is because they go to outpatient appointments and things like this. By putting it out, you have actually less trouble with parking because they would be going to their local community hospitals. That's the whole concept.
I think there was a gentleman over. Sorry, yes.
I'd like to say, Jeff Hayes, I actually worked on the building of Wrexham Park Hospital when I was in the building trade all my life. And you're quite right, when the first brick was laid, there was wholesale complaints about it being in the wrong place, and they have never ended. You're quite right that there is a need for a super hospital, the way that you've described it. And I think the final decision will really, where it actually goes, will have to come when the Department of Health have got their act together and which of these units are actually going to merge to find, to give us, because that. But having said this, the idea of a new hospital on major trunk roads is not new. It's been floating around 10, 15, 20 years, to my certain knowledge. And when it was initially mooted and calculations were done, it was found that the epicentre of the population was actually at junction 6. Now, the other reason for that was it was thought that it's South Central. The other reason for that was that the road infrastructure there would be easier to accommodate because the we have a high level roundabout at 8-9, but we have an under motorway roundabout at junction 6 where it is easier to widen slip roads and feed in rather than have to totally reconstruct a over the motorway high level interchange that we have at 8-9. So all these things do have to come because there is a cost with the infrastructure as well as the building of
Of course. And I don't disagree. I mean, of course, Junction 6 lends itself to that. I mean, I don't. The problem is, and this is the problem of choosing a piece of England. The problem is that when I go to Terry Price in Wickham and I say, oh, by the way, I'm doing this at Junction 6, he's going to look at me and go, well, what's that got to do with me? The difficulty is, or if you go, say you were merging with Royal Berks. I'm not advocating this, but just saying, hypothetically, you were merging with Royal Berks, you wouldn't choose Junction 6, because understandably, the people of Tilehurst would say, well, hang on a minute, I'm going to go from Junction 12 to Junction 6 to get to my hospital. And indeed, I've got to go from Hungerford, because it serves the rural West Berkshire area to go to Junction 6. So the problem is, sir, is that because, unless you define the population that you're going to serve by the acute trusts of which ones are merging, it's very difficult, which is why I'm not totally wedded to location. The location was chosen because I had to start from somewhere in order to provoke the debate, in order to have these meetings. I'm not suggesting for 1 second that there aren't problems with any location, because clearly there are. I just think it's a better place to start on a motorway than it is on a B road near Wexham.
Were there any further questions? Lady at the back.
Sorry, you came in late because we've only just found out about this meeting, which worries me very much on the basis we live right next to A9, and the lack of information about this, I think, is frightening.
Well,
we've only just found out about it tonight.
Okay, this is we are very. First of all, this is very early stages, madam. Secondly, it was advertised in all local newspapers.
Yes.
I did local interviews on radio, and it was on the BBC News website. There is a limit to how much advertising I can do. I did try to do my best to advertise it, and it was advertised with some. There were some issues. This is always very difficult to try and get it over to people. But
I haven't seen anything on the Royal Borough website. I haven't seen anything on the
Can I?
What I was going to say is when you're looking at locations,
Yeah.
and you may have covered this, I don't know, that site is very prone to flooding.
Yes, we've had some concerns already expressed.
We've had that discussion.
Yeah. Can I just clarify something that I said right at the very beginning? I mean, this wasn't on the Royal Borough. This is nothing to do with the council. This is not an official proposal. There isn't a plan suddenly developed that a hospital is going to start being built at Junction 8-9. This is a piece of work that Phillip Lee has done as a GP who's worked in the area and worked at the hospitals in the area as well. He's done it, and as a Member of Parliament for Bracknell, but he's done this piece of work himself looking at hospital provision here and has come up with this proposal. And as we've talked about it, that blue dot is at Junction 8-9. I haven't a particular view about that because I'm at a hospital in Maidenhead. But there are other sites where a hospital could go if the Department of Health was at some stage to decide to go down this route of having this, as some gentleman called it, a super hospital, I think, on this site. So this is very early stages. It's not an official meeting. It's not. There's no official proposal. That's why it wasn't. I mean, there are some councillors here who are obviously here out of interest to hear what the proposal is. But this isn't. This is why it's not on the Royal Borough website, because it's not to do with the council. But it was in the Advertiser, and it's been in local other local papers. Any other questions? There was a, sorry, I've got. Should we take the three? There's a lady at the back. Then there's a lady here again. Perhaps we can take the lady behind you first, before you, but we'll take the lady at the back first.
Mine's just a very quick question because I don't know. What is this Bracknell Health space? And
Well, actually, this slide is slightly out of date because this was something that the council and the trust were trying to sort out, which was essentially like a clinic for minor services. Because of funding, there's now a question as to where it's going to go. And there's even a suggestion that it will be absorbed into the Brants Bridge site, which is actually owned by Royal Berkshire NHS Trust.
and that's in Bracknell as well, is it?
And it's all just one. At the moment, the challenge I inherited was that there was a project to build a health space, there was a project to build Brants Bridge, and there was a Save the Heatherwood Hospital campaign. You had 3 facilities being earmarked for one community, which actually, if you ever needed evidence of how there was no strategic vision, you only had to come to Bracknell. And I made it quite clear that, of course, I would, if none of this happens, I'll be out there trying to defend Heatherwood like the best of them. What I'm trying to suggest is that if you go down the path of make, do, amend, you end up with the silliness of 3 centres. Actually, if you have an overall vision, you can actually be much more efficient and end up providing better care. So that's what, so this is slightly out of date, this slide, so I apologise.
My name's Susan Flinders. I'm just a local resident from the river area. I've lived in Maidenhead 26 years. Felt always it's mad that Maidenhead doesn't have its own hospital. I absolutely agree that we do have to have our own hospital. I do think I'm querying the getting rid of Wexham part of the equation. I've been to Wexham, Hillingdon and Heatherwood all in the last 2 years regularly. I was in Heatherwood last week actually having an operation, first class treatment there. The A&E department in Wexham is always crowded. It's a very unpleasant experience going there, and it's an awfully long way to travel to Wexham. And I do think that to take the A&E department out of Wexham and put it in Maidenhead might not be the answer, because I think you need both. The population is very heavy around here. Crosswell, as you said, is going to bring in more people. There's more houses planned, and getting to Heatherwood would take me 20 minutes last week. Getting to Wexham, 35-40 minutes.
Sure. Okay.
So, I think that Wexham issue is a thing.
Can I read you something? In the past 50 years, according to the King's Fund, the number of acute hospitals has reduced by 85%. And the number of sites at which elements of highly specialist care is delivered is reduced even further. In England, general acute care is now delivered in just over 200 hospitals. At the same time, the average size of hospital has grown from 68 beds in 1962 to just over 400 beds, and the average acute trust has just over 580 beds. These changes reflect developments in medical practice. Advances in medicine and surgery have driven clinical staff and equipment to become more specialised. As skilled specialist staff are scarce and budgets are limited, services have been centralised onto fewer, larger sites in order to ensure patients are cared for by staff with the necessary skills and supporting specialist equipment. In addition, there has been decreasing reliance on bed rest as part of treatment. For example, most routine surgery is now undertaken as day surgery. The average length of stay in hospital is currently just less than 6 days, and 80% of all patients have stays of less than 3 days. Having surveyed both NHS Trust and the public on service change, the Foundation Trust network found that 90% of NHS trusts said that a major change, such as hospital merger, closure, or changing the way services are provided, was necessary in their area in the next 2 years. That's 90%. Critically, 78% of trusts felt that a reconfiguration in their area would lead to maintained or improved patient outcomes, which would not be possible if the change did not take place. Of those, NHS trusts indicating that a reconfiguration would be necessary, 35% felt that there was a consensus locally about how this should take place. Local councillors were felt to be a barrier to service change in 49% of cases, as were other NHS trusts, 48%, and MPs, 40%. I say that to you because it's not about, we need hospitals that serve bigger populations. It's inevitable. This is what's going to happen for acute care. Wexham Park is the wrong location to serve a big population. We've heard about the parking. The road network around there is just not suitable, just not appropriate. So there's just a need for us to put the hospitals in better locations, and it's not just in this area. Other parts of the country have similar challenges. It's particularly acute in this area, I might add, for some reason. There's no avoiding this. And it isn't that the hospitals that we currently have are offering bad